Today is July 24th, 2022, and last week was the last time we had submitted an FDA eCopy to the Document Control Center. This is big news for us because I first started doing the FDA eCopy service as a service to our clients and other consultants back in 2016. We actually had a big problem in 1 week where Microsoft made some updates to their software, and it was putting a hidden file on our USB flash drives that we didn't know about, and it was screwing up all the e-copies. So after we fixed that problem, we decided let's actually provide this as a service to other companies because we can't be the only ones struggling with this. So we got the URL FDA eCopy. We trained everybody in our company how to do the FDA eCopies, and we started doing these on a regular basis for other clients that had even prepared their own FDA submissions and other consultants. But we were having to print out thousands of pages, and we were having to create these FDA eCopies, and it was a lot of expense. And we said, we just wish the FDA would go 100% electronic. It would make everything so much easier. And everybody wants that. We don't want to have to ship these off to the FDA via FedEx. In 2018, in February, the FDA changed their policy from printing out a hard copy of the entire submission to just printing out a hard copy of the cover letter. Now, that saved us a lot of printing. So the printer's now mothballed away, and we don't use that. We just print out the cover letter, and we put it in a FedEx envelope. We put it in the USB flash drive, and we send it off to the FDA. And it's a much more efficient process than the e-submitter was back in 2018. But at the end of September, we get really busy with people trying to beat the end of the fiscal year. And sometimes we have as many as 4 submissions going out in one day. And here's a picture of what it was like back in, I think, 2017, submitting a whole bunch of submissions all at one time. Now, July 2022, the process is totally different. Now the FDA has a new website. It's called the Customer Collaboration Portal, or CCP. And on that new website, you can check the status of your submissions. You can see when you have to have your RTA in, when you have to have your AI holds in, when the FDA is due for making a decision on your submission. You can keep track of multiple submissions if you're a submitter that submits lots of submissions for lots of companies all at once, like we do. But now you can also upload your eCopies and your eSTAR submissions. All you have to do is first make sure your submission meets all the requirements of an eCopy. So you'll still need to use that eCopy validator, but then you create a zip eCopy of your submission and the PDF cover letter. You upload it to the Customer Collaboration Portal. You don't have to use eSubmitter. It doesn't exist anymore. That went away when they implemented FDA eSTAR and published a guidance. There's no more flash drives needed, no more trips to FedEx, and you get immediate confirmation that the upload was successful, so I don't have to check on the FDA tracking site to make sure it was delivered. February 2018, this is what the process looked like. You'd submit to the FDA by a FedEx. That would take a day. They'd take a day to go through the eCopy uploading process to make sure you didn't fail for user fee hold or eCopy hold. They give you an acknowledgement letter. Sometimes it'd be the same day, sometimes it would be later. They'd have 15 days to go through the RTA screening. Then they would make their decision on whether it was going to be put on AI hold or go on interactive review. And then they would try to make a decision by the 90th day. For this, we had to do an FDA eCopy, FedEx, USB flash drives, RTA screening, and printing out copies of these cover letters. All these things had to happen. So that was a fairly labor-intensive process. The new July 2022 process has fewer steps. We don't have to check on tracking. We don't have to go down to FedEx. We can submit it at any time, day or night. You still have to wait a day to get your confirmation that the eSTAR was successfully uploaded and you didn't have any problems with the eCopy. Make sure you aren't on user fee hold. And now, because we use eSTARs instead of eCopies for our 510K or de novo, we don't even have the RTA screening. We have a technical review, which has a much, much lower likelihood of being put on hold, and it's a faster process, and there's usually fewer things to fix. You still have the substantive review process, and they determine whether it goes on interactive review or it goes on AI hold, but we should usually have fewer AI hold items to address when it's gone through the eSTAR route. We still have the MDUFMA decision at day 90 and the 100-day possibility. I've never actually seen that happen, but if the FDA couldn't make a decision in 100 days, they'd have to fill out a form for that. This new process has an FDA eSTAR template replacing the FDA eCopy. The Customer Collaboration Portal replaces FedEx. The zip file replaces the USB thumb drive, and the technical review replaces the RTA screening. So this is a much faster and more efficient process for the 510K submissions and for de novos as well. If you're uploading an eCopy, and same thing if you're doing an FDA eSTAR, when you upload it to the CCP, you get an immediate confirmation right on the screen. So I can do a screen capture of this and I can send it to the client. And the one that I did this week, you can see right on the screen here, almost midnight when I submitted that. You can't do that with FedEx. You have a cutoff time. I don't have to worry about cutoff times anymore. They're still going to do the upload tomorrow, whether I submit it at 6:00 p.m. or I submit it at midnight or I submit it at 6 a.m. When the FDA gets in, they're going to process the ones that are in the system that day. So that's a much more streamlined process. And if I have any issues, I can contact the FDA at that email that's provided there. And in this case, I redacted what the file name was, but it even tells me what file I uploaded. So I have a record of that. If you need any help with your e-copies or your eSTAR, I'm publishing a blog on later on today. Here's the URL on the page, and I'm actually going to embed this video on that page. But if you have any questions, there's going to be a link below on this video on YouTube where you can actually see our eCopy services. So you can go there and order those or read this article or learn about our FDA eSTAR process. And if you're actually reading the blog, there's a hyperlink down below in blue for the FDA eCopy process, explaining that and the services that we offer. So hopefully this will help you. Now you won't have to make any trips to FedEx yourself. You won't have to print out any flash drives, and you will also be able to get your submissions done at any time, day or night, no matter what time zone you're in.